Now our GMA cover story. We have more on that medical breakthrough for women that are suffering from postpartum depression. The FDA has just approved a first-of-its-kind medication to treat it. Dr. Jen Ashton will join us again in a moment. First, Diane Macedo has the story of a young mother whose life was changed by this new drug.
I want a cookie, please.
For Stephanie Hathaway, there's nothing better than being a mom to 4-year-old Hadley and 2-year-old Brenley.
They're a ball full of happiness. I love it. It's the best job I've ever had.
I'll sit next to you, Mommy.
But motherhood hasn't always been easy. Stephanie says she suffered from crippling postpartum depression after both of her pregnancies, something the Connecticut mom had never even heard of before it happened to her.
I was unable to make myself cook, unable to make myself clean, very difficult to take care of the baby. It was just a time of a lot of struggle, a lot of hopelessness, and a lot of fear.
Stephanie says she was also plagued by depressing thoughts that ran on a constant loop inside her head.
Your daughter deserves a better mom. Your husband deserves a better wife. And I was scared of what I might do if I put her down.
But when antidepressants failed to help after her second birth, the 33-year-old decided to take part in a study for a new drug called Zulresso, the first ever medication made specifically for women suffering from postpartum depression. The drug requires a 2.5-day hospital stay while it's administered through a single 60-hour IV infusion. Stephanie says she started to feel better within just a few hours.
The intrusive thoughts went away and they did not come back. I called my husband and I just remember my husband saying, "Wow, I haven't heard the you in your voice in so long."
About 1 in every 9 women suffer from postpartum depression in the U.S. Symptoms can range from sadness to thoughts of self-harm or even fears of harming the baby. Zulresso works by targeting a unique set of receptors in the brain different from the ones that are targeted by traditional antidepressant medications. And while some women may be wary of treatment that requires a hospital stay, Stephanie says for her, it was worth it.
It was very much like a cloud was lifted, and I just remember walking out of the hospital feeling like me again.
Cheers.
For Good Morning America, Diane Macedo, ABC News, New York.
Our thanks, and Dr. Jen is back. So for people who are not familiar, just explain what this is.
Well, first of all, postpartum depression, Robin, to be clear, this is a life-threatening medical emergency. There's so much stigma and myth about it. It's not about being overtired or hormonal, and this affects not just the woman and her baby, but her entire social circle. 1 out of 9 women, as we heard in Diane's piece. So this is major news in the world of psychiatry and women's health. This drug, historic. It's the first drug ever to be approved by the FDA to treat postpartum depression. It does work differently, as we heard, than other antidepressants, mainly because they can take 3 weeks to see an effect. This one, the results are almost immediate. So again, that is major relief and potentially life-saving.
Explain more why this is potentially such a game changer.
Well, because of the rapidity with which it works, because of its approval, because it works differently, it opens up area of research for other drugs like it. But again, your question, I'm sure, is what about the downsides?
Right.
They are massive with this, Robin, and the biggest one is the cost. This drug comes with up to a $35,000 per dose price tag. Who is going to be able to afford that? And Medicaid and insurance, will they cover it? As a practicing physician, I can't imagine that they will. It will only be given in hospitalized centers with direct medical observation because of the potential side effects of loss of consciousness and sedation. So the logistics are going to be tricky. This isn't going to be something you can go to your pharmacy and get. And breastfeeding, you know, women are breastfeeding. They will not be able to breastfeed while they're actually getting this infusion, so they'll have to pump and dump, as we say.
Are there other potential issues?
I mean, really the biggest one is the logistics and the cost. I mean, I think it's great to have finally a drug that can offer help to women, but $35,000, whether you have insurance or not, that's going to be a major issue.
And the stress, again, this isn't just the baby blues. You know how somebody will try and kind of discount it. This is serious.
This is a major cause of postpartum death amongst American women and women worldwide. So this is, to be clear, not an issue of, just shrug it off. It's you know, all in your head. This is a big life-threatening issue.
All right. So much more to discuss. You're going to be on Facebook?
Yes, I am.
I know people are going to have some questions
That's
for
right.
you, and you're the woman for it.
Thanks,
All right,
Robin.
Jen, thank you. Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here. To get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.